Welcome back to the MRHA Voice of Rural Health podcast. I have a special guest on with me, Ilene Rosenthal, from the Maryland chapter, I believe, of the Alzheimer's Association. So welcome, Ilene. And can you tell me a little bit about yourself?
Thank you. Thank you, Jonathan. It's a privilege to be here. So I am the program director for the Alzheimer's Association Greater Maryland chapter. So I have the privilege of overseeing the variety of services and programs that we offer and just building our reach, trying to connect people with services. We know that it's a challenge for so many families, and we are trying to help make this more of a household word so that families know where to go and who to call when they receive a diagnosis of dementia.
Wonderful. Thank you for that brief overview. And again, welcome on to the podcast. So I have a few questions lined up for you today, and I really want to chat a little bit about what Alzheimer's disease is in Maryland, and is it related to any prevalence data released last summer?
Well, I'm glad you mentioned the prevalence data. So unfortunately, Maryland is the state that's considered to have the highest prevalence of dementia among the 50 states. And in particular, Baltimore City is tied for first place with Bronx, New York, and Miami, Florida, among jurisdictions with 10,000 or more people age 65 and over. So that's not a list we want to be on. And we are working very hard to try and address what we think are some of the contributing factors and just generally raise awareness. So I appreciate your helping us do that today.
Yeah, absolutely. It's our pleasure to assist. And can you tell me maybe why it's so high in Maryland compared to other parts of the country?
Well, I don't know how knowledgeable people are, but this disease is disproportionately affecting people from communities of color. And so if you are African American, you are twice as likely to have some type of dementia in your life. And if you are Latino, it's about 1.5 times as great. And why is that? There are a lot of contributing factors. Obviously, historic healthcare disparities and just generally lack of access to quality healthcare. Failure to recognize the early warning signs. So often people just assume that when grandma forgets their grandson's name, that's normal aging. And people, there's also the stereotype, the embarrassment, the shame. And so we're trying to do a better job of helping people come to terms with this and not hide it. There is an expectation that during the annual wellness visit, physicians will do a cognitive assessment for their Medicare beneficiaries. And it's probably not being done unless the patient says, "Doc, I'm having a problem." And then I've also had people tell me that they've said that to their healthcare provider, and the answer they got was, "Well, that's normal for your age." And in the absence of any type of cognitive assessment, we don't know if it's normal aging or not normal aging. And so we really want our healthcare providers to be more proactive about early detection. We think it's critical that they do a brief cognitive assessment during the annual wellness visit. Obviously, it's not going to lead to a diagnosis on the spot, but it will pretty quickly help them distinguish patients that should be referred for further studies from patients that are experiencing normal aging. So in Maryland, you asked, why is it so high in Maryland? Well, we have a very rich diversity in Maryland, and that's probably why, especially Baltimore City and then Prince George's County also is on the top 10 list. And so there are many, many contributing risk factors. I've talked about some of them, but we also know that there are also high incidences of cardiovascular disease among the African American and Latino communities. And so, you've heard the expression, what's good for the heart is good for the brain. So if we can do a better job talking about these things, putting it more in the open, getting people comfortable with it, reducing that embarrassment and shame, encouraging people to step forward, and really connecting people more effectively with services and resources. I think we can do a better job in getting Maryland and Baltimore and Prince George's County off those bad lists in the years ahead.
Thank you for all that vital information. And you mentioned, early detection. I know that we've worked with some groups on some early detection for, cancer. So I see the similarities and the benefits of getting screened earlier on. Obviously, there are some barriers that you had mentioned that prevent individuals from, getting that screening. Also, you talked a little bit about diversity. Diversity is great in Maryland, obviously. We have our urban centered areas around Prince George's and Baltimore County, Baltimore City, Howard, Montgomery, and then we have our rural parts as well that are, 18 of the 24 jurisdictions in the Maryland are considered rural. So there is not only great diversity in the geographical area, there's great diversity among race and different populations. And so I understand that Maryland's been very proactive. Obviously, your organization has been very proactive to advance health equity. So I think that's all, fantastic work that we're trying to do. And, to segue into the work that we're trying to do and advance some of these priorities, what are some things that our listeners can do to, not only assist your organization, but try to decrease or maybe not decrease the rates of Alzheimer's, but maybe to help individuals identify it earlier on so that they can get the resources that are out there and available to them. So what are some things that we could be doing to help you?
Well, the very first thing is what you're already doing, and that's raising awareness. We have to do a better job of helping the public understand what those early warning signs look like. I'll give a talk to a group and I'll say, raise your hand if you've ever walked into a room and said, what did I come in here for? And just about every hand goes up, including mine. But for most of us, we're able to go back and then reconstruct and say, oh, right, I meant to get this. Well, someone with dementia probably wouldn't be able to do that. Or where's my keys? What happened to my keys? Where are they? I don't know where they are. Well, yeah, our phone. We put our phone down and we're always like, where did I leave it? Where did I leave it? So, oh, right, it's in the bedroom or it's in the kitchen. But for someone with dementia, maybe it's in the refrigerator or freezer. That's not a normal place where somebody would put their phone or their keys. So it's really important to learn about those early warning signs and not be afraid to talk to your family about it and not be afraid to talk to your healthcare provider. The other thing, the family, sometimes the family sees the signs, but they too are avoiding it. They don't want to go there. They don't want to have that conversation. They're just in denial. And we've got to get people more accustomed to accepting this, because what if it is something that's reversible? Why would you deny someone access to healthcare that could potentially reverse the cause of dementia? Even though that may be a small percentage, we still need to explore it, and it has to be done by someone, a medical professional. So we have to raise awareness. We have to help people better understand those early warning signs and not be embarrassed, not be afraid to talk to their family, and not be afraid to bring it up with their healthcare provider. And then
absolutely, and continue, please.
And then, so education. The other thing is, we talk about prevention, and while there is no cure right now, there is increasing literature from research that's telling us more and more about the lifestyle factors that can contribute to increased risk for dementia. So we know that things like lack of exercise, a poor diet. I know in some areas where people live, they may not have access to an abundance of fresh fruit and vegetables. And sometimes the processed foods are easier and quicker to access. But really, diet is very important. And I'm not saying people need to eliminate all those things that they love and cherish, because it's not about eliminating. It's about being judicious and knowing when those fun occasions are that you want to indulge a little bit in those things that you really shouldn't have, but don't deny yourself, have it during those special occasions. even fitness, exercise. It's not rocket science that anything that blocks the flow of oxygen to the brain can put someone at risk for future cognitive decline. So we talk about that. We also talk about the importance of social stimulation. We were all horrified at the impact that COVID had on people, especially older adults who were shut in 24 hours a day for a couple of years, and how that had contributed to decline because of that lack of social stimulation, that inability to interact with people in their network, in their circle, in their family. That was bad for everybody, but especially people with some dementia, because that lack of stimulation was not good, because stimulation is just extremely important. Intellectual stimulation is also important. So we always tell people, if they are telling us their family member was newly diagnosed, we always say, keep going, keep moving, live your life, go out, do everything you can, exercise, think about diet, just keep on moving, go out to, whatever is fun, enjoy, because the stimulation is really important. But what's even more important is that increasingly the research is underscoring a relationship between those lifestyle factors and future risk for Alzheimer's disease. So while, again, it's not a cure, we also know when you look at the cardiovascular disease impact, if you can reduce obesity, if you can change someone's diet, if you can get people moving, if you can, address high blood pressure at an early stage. We don't wait until someone has their first heart attack to start treating them for high blood pressure or for heart medicine. And I hope we get to the same point with Alzheimer's disease, especially as new blood tests may become available in the foreseeable future that will help increase rates of early detection, and will be able to identify the pathology that's in the blood that's also in the brain that's associated with Alzheimer's disease.
Thank you for that wealth of information. And I think, one thing that I caught out there at the very beginning of your talking there was that denial, obviously, with families and family members from that early diagnosis and getting someone screened, obviously, for dementia. I have a good, personal connection. Obviously, my grandparents, both my grandmas, as they continued to age, we've seen a very cognitive decline in their memory over the last several years of their life. And obviously, I think the family members were all in denial of it, right? And obviously didn't want to have those hard conversations, with the family members to get them treated or seen at the physician's office, and raise these very tough questions. And again, not necessarily to reverse, obviously there's no cure, but to have those conversations about what are some things that we could be doing to assist, right, and making life a little bit easier for those individuals and family members. And so again, segueing into the diagnosis of dementia, and obviously someone that may be just diagnosed, what are some things that initially they should be doing with the association or in general?
So I would suggest to everybody that they connect with their local chapter of the Alzheimer's Association. We have over 70 chapters around the country. And in Maryland, the Greater Maryland chapter does serve the rural counties. Southern Maryland is served by the National Capital Association chapter, but our services are very consistent. So I would suggest that someone call our helpline, and that number is 800-272-3900, and clinicians are available 24 hours a day. And one of the first things I would recommend is that they request a care consultation by phone, and someone will set up a time to talk to the family, and they'll ask questions, and they'll help the family begin to think about short-term planning and long-term planning, and they'll connect them with resources and services that are available, whether they be through the local chapter of the Alzheimer's Association or their local office on aging or local health department. They're a pretty good repository of information about what's happening at the local level. The other thing I would recommend, especially to the care partners, learn everything you can about the disease. there is nothing instinctive about caring for somebody with dementia, and you need to be prepared for some of the challenges that lie ahead. And so often, a well meaning family member thinks they're doing their loved one a service by putting them in their own reality, when the exact opposite is what they should be doing. So, if grandma asks for grandpa who died 10 years ago, the answer should not be, oh, don't you remember he died 10 years ago? So often that will happen. That conversation will repeat itself, maybe sometimes several times during the course of the day. And as the day goes on, grandma gets upset and she's now mourning and she's crying and she's agitated, and she may even hit somebody because she's just so upset. And yet, if the care partner had realized, maybe the best answer is, oh, maybe he'll be back tomorrow. He's not here now. And just try to redirect her away from something that could be painful for her. So often, and I've seen this in healthcare, long-term care facilities too. I've seen, sweet ladies roll up in their wheelchair up to the nursing station and say to the nurse, I want to go home. And the nurse says, honey, this is your home. And then she hits the nurse because the mental image she has in her head is of that home she used to live in, not the nursing home that looks to her more like a hospital. And so we have to really be mindful of that, and we don't want to escalate a situation. We also have to be, like I said, be prepared for the challenges, understand how the disease progresses over time, what some of those challenges are that a family member may see, and how to be prepared for them, how to engage their loved one in meaningful activities. So there's so much out there to learn. Also, legal and financial planning. Nowadays, when you go usually to a hospital, the first question they ask you is, do you have advance directives? And while it's surprising, there are still a lot of people who do not. So imagine you have a family and now they're confronted with this diagnosis, and suddenly they're in a mad dash because they know they never put together any of the legal documents. And it's like, oh, yeah, I'll do it tomorrow. And tomorrow never comes. So now they have to find an elder law attorney. They have to have their advance directives because they need to know what mom would want done if she gets to that point where she's no longer able to direct her own care. And I've seen horror stories where here's now mom, later stages, she's, not communicative anymore. And then she gets diagnosed with lung cancer. And one child says, oh, mom, we have to do chemotherapy. And the sibling says, no, she wouldn't want that. And yet mom didn't put it in writing. She didn't have advance directives. She never talked about it with her kids. And here they swear they know what she would want, and they're on two different pages. And so it's really important to get those documents in order, to identify who's going to handle your financial affairs when the day comes that you aren't able to do it. You have to have a durable power of attorney and a will. Please, don't let your family argue. Make sure you handle all of that in advance. We even teach a class called Managing Money that gets into the legal and financial planning. What are those important documents that everyone should have? And what covers long-term care? How do you pay for it? What does Medicare cover? What does Medicaid cover? Surprisingly, a lot of people assume that Medicare covers long-term care, and they are totally shocked when they find out that they can't manage mom's care anymore, and she needs to be in a nursing home. And guess what? She doesn't qualify yet for Medicaid because she still has assets, some assets. And so you literally have to spend down to about $2,500 in order for Medicaid to cover long-term care. A lot of people don't know that. There's also veterans resources. We always ask people, are you or was your loved one a veteran, and did they serve during active wartime? Because that could trigger a veteran's aid and attendance benefit, which could pay about $2,000 or more toward the cost of long-term care or in-home care. And even the spouse gets a partial benefit if they require those services. So it's important to know that. So legal and learning everything they can is so important. Also learning about where are we with research and what are those clinical trials? Well, who's recruiting? I know it's less accessible in rural areas, but some clinical trials don't have geographic barriers. For instance, one that we're involved in right now with Johns Hopkins is called Memory Core, which is testing the efficacy of meaningful engagement on the person living with dementia and their care partner. And then they have a volunteer companion assigned to each couple. And so it's that's a study. You don't have to have give a blood sample, no lumbar puncture. And that's a great study. I don't know if they're still recruiting. It is beginning to wrap up. But again, my point is a lot of the studies don't involve drugs. They don't involve things that require someone to go to a specific geographic location. Sometimes it's a survey of caregiver stress and looking at different ways to reduce caregiver stress. Or again, like Memory Core, looking for ways to engage the person with meaningful activities that can ensure a higher quality of life for them and more fun things to do. So look at research and just, again, getting plans made and navigating services. I have to tell you, one of the worst things I ever hear is when someone says, "Oh, I didn't know the association provided all these services." And so it's painful when someone says, "Oh, I could have used you when I was a caregiver." So we want to make sure that people know what those services are that are available. Maybe it's a support group. And we have over 40 support groups in the state of Maryland. And some are specialty groups, some are in person, some are virtual. Among the specialty groups, one is for people who have younger onset Alzheimer's. Those are people diagnosed below age 65 who are in the early stage. And so each month they attend with their care partner. And sadly, one of our most robust support groups is our early stage younger onset group. There are a couple of gentlemen who were in the group who were interviewed on local public radio station, and they shared that, they all went into the support group. They were really pessimistic. They had just gotten this life-changing diagnosis. The world was ending as far as they were concerned. And then they go into the support group and something magical happened. They met new people. They bonded with the other members who were also living with Alzheimer's, and everything changed. And the three of them enjoyed each other's company so much that they would FaceTime once a week in between the monthly support group meetings. And so people heard about it, and we got calls from outside of the chapter area from people who said, "We don't have anything like that in our area. Can we join this group? It might be an hour ride, but we need to be there." And so that was wonderful. But that group now has about 40 people, including the adult children that attend each month, and they've also bonded with the other adult children. So I highly recommend support groups. Among the other specialty groups we have a Korean language group, we have a Spanish language group, we have an LGBTQ group, we even have a bereavement group for people who have lost someone to dementia, because for many people, they've bonded with the other support group members, but it feels a little awkward. It's like they still need the support, but it's a little awkward to be there with other people who are still actively caregiving. And so we have a support group that is in partnership with a local hospice. So people who have experienced a loss have a natural place to go after that happens. And again, education. I mentioned managing money. Another one is called the 10 warning signs, which is the one that helps people understand the difference between the normal aging and something you should talk to a healthcare provider about. We also have a program on effective communications. We have one called Managing Difficult Behaviors. A high percentage of people who have Alzheimer's will experience some behavioral issues as the disease progresses later in the progression. So we have many different ones. The one I referenced before, called Healthy Living for the Brain and Body, is the one that talks about what the latest research is telling us about those things we all can and should be doing that could potentially decrease our future risk for cognitive decline. We even have a multi-week series called Living with Alzheimer's for people who are experiencing, and it's a 3-week early stage, 3-week mid stage, and 2-week end stage. And the first 3-week early stage, the person with the diagnosis attends with their care partner. Speaking of early stage, We also have a number of early stage programs because, again, our message is go out, do things, be active, live life, enjoy life. So, for instance, we have been invited by the National Aquarium to bring a group of people for free. Now, I know that's in Baltimore. It's not typically convenient for someone in a rural area, but that's an example of an early stage program where they will be able to tour the aquarium at no cost. In the good weather months, we've done things like picnics, we've taken people to baseball games, we've taken them to museums. We have a wonderful volunteer who leads these early stage programs. And again, it's a wonderful social experience. It's an intellectual experience. One year we took people to the zoo, and they spent most of their time in the penguin area. And then after they left the habitat area, they went inside, and the zoo brought out a penguin and sat it on the table. So everybody got to get up close and friendly with this penguin and hear more about the penguin and its habitat and lifespan and everything else. And they were just, really excited to get that close to a penguin. So there's lots of activities. Sometimes we do art projects, and sometimes they're virtual. So we might, if you sign up for it, we could mail the family a kit ahead of time, and then they know to log on at a certain date and time, and the art instructor will deliver a virtual class on how to create that art project. So again, education is key, but also connecting people with services. We want the best possible quality of life for people, and we want to help people navigate that service landscape, which is very complicated. People really don't know where to go and who to call. And so we want very much for people to know that there is support, and we want them to know where to go and who to call. And I can tell you that our 24/7 helpline, I mentioned that they're a huge repository of information. But almost any question that a family member could have is likely something that they can answer, whether it's, mom was just diagnosed, I need an elder law attorney, or do you have a list of adult daycare centers near me, or, dad's exhibiting some symptoms that are worrying us. Do you have a list of geriatricians or neurologists in my area? Or maybe someone is interested in research and wants to know what kind of clinical trials are going on in Maryland and who are they recruiting? And, if we wanted to get involved, how would we do that? And we do have a program called Trial Match, which is sort of like Match.com for people interested in clinical trials. It asks them to fill out a form, like a profile, and then it will identify for them clinical trials that are happening in their area that may be looking for people like them. So again, if they can call any time of the day or night, even if there's like a behavior issue, 3 a.m., and, dad wants to leave the house. It's January, it's 20 degrees out, and he's trying to bolt out of the house, and his wife doesn't know what to do. She can call the helpline, and the clinician will sit there and coach her through the situation, try and understand what's driving that behavior, and try and redirect that behavior in a meaningful way. So again, 24 hours, 3 a.m., 3 p.m., it makes no difference. If someone wants to know, well, are there education programs? I heard about this managing money. Yeah, we need that. Is there one coming up near me, or is there one online that I can observe? And they'll have that too. They'll be able to tell you exactly where these programs are, and they can even register people. So any programs that we do have, you can call the helpline and they will register the person for it. We often will have a flyer with links, but anybody who is not comfortable with that technology, they can always call that helpline number. Again, 800-272-3900. The other important thing I wanted to mention is those who do like the technology, spend some time on the Alzheimer's Association website, because we have really a host of online tools. There's a caregiver center where people can access information about early stage caregiving, middle stage, and even late stage. There's something called Alz Connected, which is really an online community to connect other people living with early stage Alzheimer's with each other. We have All's Navigator, which is an interactive online tool for people with dementia and those who are providing care and support in helping make decisions. It has an assessment tool that can help the family evaluate the needs, and it can help outline some action steps for them. And then our community resource finder. That's sort of like our version of Google. And you can go to the community resource finder and look up almost anything. There's about 6 or 8 different categories of services. It might be medical, it might be education or support groups. It might be, elder law attorneys, specialists, and you can search for that online. It's like I said, it's a information database that's accessible online. And then we have a virtual library. So a lot of the things that may prompt somebody to call our helpline, there are many, many tip sheets and documents in our virtual library. And so if they were to click on alls.org/library, they would be surprised by the host of information and variety of topics that are available that they can easily download and review. And all of the education programs that we offer, there are pre-recorded versions of those programs that exist on the Alzheimer's Association website. It's great, especially if the caregiver can't even begin to think about it until 11 o'clock at night. The downside is it's not interactive, but it's still very informative and gives people a lot of useful information. And then, as I mentioned before, the TrailMatch. You can fill out the TrailMatch profile online by going to alls.org/TrailMatch. So again, a wealth of information, and I just hope people will hear about it, read about it, and follow up, because this is not a journey people should try to take alone. It does take a village.
Thank you, Ilene, for all that wonderful information. One of the things that I took away from that, obviously the financial piece that you mentioned early on, being a challenge in the paying for, long-term care. I was listening to a podcast not too long ago that was talking about qualifications for Medicare payments, and obviously having to spend down funds before certain criteria meet eligibility. So all that makes really relevant information. Obviously impacts thousands and thousands of people, not only across our state, but across the country. And I think that some of the resources that you have available to them, I think would be very valuable. And we're going to make sure that we, include these resources and links into our description of the podcast, and obviously put them on social media when time comes. But is there anything else that you want to talk to the audience about getting involved with the association?
Sure. So we are a volunteer-powered workforce, and we have a couple hundred volunteers throughout the state of Maryland that are actively engaged in their local communities every day, whether it's delivering education programs, facilitating support groups, representing the association at a local health fair, or building a walk team or volunteering to work on the walk. And so we do have 6 walks, and several of them are in rural parts of the state. We always love to have volunteers help us with those. Also advocacy. We are the voice, and fortunately, this is not a red or a blue issue. We have been very successful in gaining support on Capitol Hill from both sides of the aisle. There seems to be a deep appreciation for the need to invest more money in research and more money to improve quality outcomes for people who are affected. So we typically will have a legislative agenda at the national level and at the state level each year. And we have volunteer advocates all over the state who are making their voices heard. They are meeting with their local state elected officials as well as their members of Congress. And I can tell you, it does move the needle. I have had the privilege of going to Capitol Hill with people who were living with dementia and their care partners. And when we got into a meeting with their member of Congress, I didn't have to say a word. They spoke eloquently and their remarks were moving. And it was very clear that the member of Congress heard them and understood what this disease does to people. We often will have people who had lost their jobs. They were still working. Maybe they were in their 50s or later, and they lost their job. We had one gentleman who was a satellite engineer, and he made a mistake that caused the program to go off air for about 20 seconds, and they fired him. It wasn't until after that that he got his diagnosis. So when people tell their story, it used to be you had to fight to get an early Social Security benefit, but now they have a compassionate allowance for people who are lower than the retirement age, who have a health issue, a disability, or Alzheimer's disease that makes it impossible for them to work. So volunteers are needed everywhere, and they can go on our website and look at some of the volunteer opportunities. We need folks to do outreach, to really raise awareness. We do faith-based outreach. We're always looking for people. And just to be that ambassador, to encourage people they know. Don't put it off. Talk to your healthcare provider. I want to talk a minute about early detection because, I mentioned some of the advantages in terms of legal and financial planning and access to services, but there's one relatively new urgent reason for early detection, and that's the growing availability of treatments. While we still don't have a cure, some of the more recently approved treatments are showing great progress in terms of being able to slow down the decline and delay the onset of symptoms. And there are many more clinical trials going on right now, and one is waiting for federal approval that has shown tremendous promise in research. In fact, they took people in the study, they took people off of the drug because it was designed to remove the protein deposits in the brain that are associated with Alzheimer's. And when it showed that it succeeded in doing that, they suspended the treatment. And a year later, a third of the study participants showed no additional decline in cognitive function, which was pretty impressive. And so it's sort of like the early days of the cancer drugs. It was something. It gave people hope. They didn't, do what they're doing today. But look at the changes that have occurred in that landscape and in HIV. And I'm really optimistic. I really believe that one day we're going to have a better idea of how to prevent this or how to treat it more successfully. But again, these new drugs that are coming out and are currently available are only good for people in the early stages. They're not going to help people in the later stages. So we have a more urgent reason why we have to get people diagnosed earlier so that they can make a decision on whether they want to participate or receive some of these new drugs that are coming. One of my greatest fears is, especially in our rural communities, and in our more diverse areas where there aren't or may not be easy access to specialists. We know that sometimes it could take, just for regular people, it could take 2 years to get a diagnosis because the symptoms in the beginning are kind of vague and they're not really showing up on any of the imaging studies. And perhaps 2 years later is when you get that definitive diagnosis. But I also know that people in communities of color, it may take double that. So imagine you're 4 years into your journey when you get this diagnosis, and guess what? You've just been shut out of these new drugs because you're too far, you're too advanced. Well, that is going to create a whole new health disparity that is unacceptable. So we've got to do a better job at getting people diagnosed earlier so that they can make a decision on whether or not they want to seek the treatments that are available and the ones that will become available. So again, I can't urge enough the importance of recognizing those signs and getting that diagnosis, moving it up earlier.
Thank you, Ilene, for all this wonderful, valuable information to our listeners. Again, want to thank you for being on and taking the time out of your busy schedule to be on. We'll make sure, again, to include all the links to this great information and resources to our description of the podcast, and obviously, again, on our social medias, so that everyone has the availability to access all of this great information that, again, I truly think that Alzheimer's and dementia impacts every family in some sort of fashion. So again, I think these resources are very valuable, and we'll make sure that we get them out there to everyone that needs them. So again, thank you for everyone for tuning on to the Maryland Rural Health Association's Voice of Rural Health podcast. Tune in to the next episode that will be released in the next few weeks.
Thank you,
So
Jonathan.
thank you.